since they adjusted my medications, I'm feeling much better. Matter of fact, that's why I'm here. I'm here to see Dr. Mason because my body's adjusting to the medication, and once I start to feel good, I want to continue to feel great.
Mr. Jones, Dr. Mason is ready to see you now.
It is very important to be ready to take these medications. If someone is not sure if they can consistently take the medications, then that's a conversation that they need to have with their provider. Maybe there is a different dose or a different schedule that is going to make it easier for them to remember to take it every time as they should.
Mr. Jones, it's good to see you again. Would you like to have a seat?
No, this will be fine right here.
Okay, how have you been since I last saw you?
Well, I thought about what you said, and well, I'm here.
I'm sure the last visit there was a lot of information for you to handle.
I received your phone call about my numbers, and my nephew, I told him about it. That's why he dragged me here today.
He has a lot of questions back at the house, and I just figured he needs to talk to you and learn a lot more.
Well, I'm glad that you did come because there has been some changes in your numbers, your viral load and your T cells that might indicate that this is the right time to think about starting treatment. It's a life change. I think that you've had an opportunity to think about it. But before you even start that, you need to understand what HIV is actually doing in your body and how your T cells are being affected by the HIV virus. Do you mind if I show you a video?
No, not at all.
Okay.
You have all kinds of blood cells in your body. You have red blood cells that carry oxygen, and you have all sorts of white blood cells that fight infection. One type of white blood cell is called the T cell, which is also called the CD4 cell. These are the cells that fight infections. In this video, we will call them T cells. The body has a lot of these T cells. Bacteria and viruses, such as the flu virus, can come into your body at any time and cause you to get sick. When a bacteria or virus comes into your body, it's the job of the white blood cells, including the T cells, to fight it, and either keep you from getting sick or help you recover if you do get sick. Your body needs T cells to stay healthy. The more T cells you have, the better. You need your T cells to fight certain kinds of serious infections.
Does this make sense to you?
Yes, it does. So that's what T cells are.
Yes, the next episode of the video is going to explain to you how HIV affects the body.
HIV is a virus. It enters the body, gets inside the T cells, and immediately starts creating more and more copies of itself. Then the T cell bursts open, destroying the T cell and releasing more HIV into the bloodstream. During the time when you're not taking HIV medicine, the amount of HIV in your body will grow as time passes. Eventually, there will be millions of copies of the virus floating around in your blood. All of these copies of HIV will be destroying T cells. This measurement of the amount of HIV in your blood is called your viral load. A healthy body without HIV has no virus in it. You want as little HIV in your body as possible. HIV destroys the cells that fight off infections, so that your body can't protect itself from diseases as well as it used to. That is why it's not good to have a high viral load, because this means there are millions of copies of HIV in your body, all of them destroying T cells. You might feel pretty healthy even though you have a high viral load, but you are losing T cells and your body's defense system is getting weaker. As soon as you catch an infection, you will probably get very sick. The good news is that if you take your HIV medicine, you can lower your viral load, and then your body will be better defended against infections. When your body can fight off infections, you will feel healthier.
But I feel great. I don't understand why I should even be thinking about it. I have a friend who just started taking medication, and she's not doing so well.
Mr. Jones, there's a lot of persons that are HIV positive who feel good, but it's really the T cells and viral loads that would indicate that you need to start treatment. Do you mind? I have another video.
The video will give you more answers.
Okay.
It'll explain how the HIV medications work.
As we mentioned, you want as little HIV in your body as possible. HIV medicine works by lowering the amount of HIV in your body. It stops HIV from making more copies of itself. By stopping HIV from multiplying in your body, the HIV medicine saves your T cells from being destroyed by HIV. The HIV medicine has to be very strong to stop HIV from multiplying. This strong medicine may cause some side effects at first. Some people get nauseous or get headaches when they first start taking the medicine. But these side effects usually wear off after several weeks as your body adjusts to the new medicine. Also, if you're going to start taking HIV medicine, you'll need to be ready to take all of your doses of medicine every day and on time. This is called good adherence. It can be quite challenging to achieve good adherence and keep it going over the long term. You may need to get support and services so you can achieve and maintain good adherence. The main goal of taking HIV medicine is to get to an undetectable viral load, which means that there is a very small amount of HIV in the body. The less virus you have in your body, the more T cells you'll have, and the healthier you'll be. You want your viral load to be as low as possible, and your T cells to be as high as possible. This will increase your chances of a long and healthy life. For most people with HIV, the way to achieve this goal is by taking HIV medicine.
I realize that this is a lot of information for you, Mr. Jones, but it's not a decision that you have to make right now. You can go home, you can think about it, and we can meet again.
If I start taking these medications and I reach an undetectable viral load, will that mean that I'm now cured of HIV?
No, it does not mean that you're cured. It just means that the virus is not detectable in your blood. Even though you have an undetectable viral load, it's still possible to transmit the virus to other individuals.
Really? Does that mean that I'll have to be taking this medication for the rest of my life?
Most patients that start HIV medications do have to take their medications for the rest of their life. It's like any other chronic illness. In order to control it, you have to stay on the medications. If you stop and start your medication, you might introduce what we call resistance, where the medications might not work as effectively as they did before.
So that means that I'm going to have to take, what, 10 to 20 pills a day?
No. We've come a long way with our regimens. Most of our medications are taken once or twice a day.
You know what I need?
What?
I need to speak to somebody who's already started medication.
Judging on how I feel, I know that the medication is doing something in my body, but I don't know quite how it's working.
The medicines are working by stopping the virus from replicating itself, therefore decreasing the amount of virus that's in your body and increasing your T cells.
And I'm not actually feeling like my normal self or even healthier.
It's not unusual that when you start medications that you don't feel like you did before you started taking medications. Most of the side effects that you are experiencing right now, they will subside and get less over time as you continue to take the medications.
Well, I'm feeling better than last week, but I'm hoping to feel better. I'm not too sure, what should I be doing, or if I'm not feeling well, should I stop the medication?
No, it's important that you do not stop your medication, because if you stop your medication, you might run the risk of introducing resistance and the drugs won't work as well as they did before. If you're having some symptoms that are interfering with your daily living, just give me a call and I'll be more than happy to bring you in and talk to you again and see what we can do, because sometimes we can manage some of the symptoms that you're experiencing without stopping the medication.
If someone is having a lot of side effects, or maybe is finding that they're missing a lot of doses and they're thinking about stopping taking their medication, they need to talk to their provider first before they stop anything. Many of the clinics have programs that can help people to be adherent to their medications. So it's very important to speak to your provider, speak to the staff at the clinic, and find out what's available for you. There could be support groups, there could be other types of reminders to help people to either get ready to take their medications, or if they're already taking the medications, taking them as they should regularly.
I'm just a little concerned that how my blood work. Is it high? Is it low? The T cells?
Well, believe it or not, Yvette, you've been on the medications for a very short time, but we've got good results today. There's been a change and there's been a reduction in your viral load and an increase in your T cell. But as you continue to take the medications, we're going to see much more improvement. We're going to see better results.
I'm doing better then?
Yes, you're doing better.
Well, I hope so. And I can't wait until these side effects go away.
They will. As you continue to take the medication as you're supposed to, they will get better. The side effects will decrease and you'll start to feel even better than you did before.
One of my major concerns is the long-term side effects, and I want to be able to do everything possible to avoid that.
I understand your concern about the long-term side effects from the HIV meds, but I'm going to be monitoring you very closely. I'm going to be seeing you every 3 to 6 months, so I'll be able to follow you. But there's things that you can do as well. You can diet, you can exercise, you can get rest, and you can do other things such as therapies, yoga, acupuncture, acupressure. These are some of the things that could help you with some of the long-term side effects that you might be experiencing from the HIV meds. It's been shown that people that are HIV positive who take medications do live longer and have healthier lives. They reduce the risk of having infections, they reduce the risk of hospitalizations, and they do much better.
Wow, that really sounds like a plan. I look forward to coming in.
I'm looking forward to seeing you again. You're doing well, and keep up the good work, and we'll see you soon.
Thank you so much,
Okay.
Doctor.
Thank you. You're welcome.
There are definitely benefits to taking the medications, and one of them is that once your body gets used to the medications, you will feel better. HIV can cause a lot of fatigue, and once you start taking the medications and the viral load goes down, you will feel better. You'll have more energy. You will not get sick as often. So that means that you won't be going to your provider as often for sick visits, and you will also not need to go to the hospital. You will live longer. For a lot of people, they went from planning their funerals to planning their retirements.